Good morning, all. That's a research work, a descriptive research on the causes and effects of nursing shortage in Enugu State, Nigeria. And this is a presentation by Okeke Ogechi Esther. Okay. Where can I scroll down? The keywords for this have nursing shortage, baby boomers, nursing, nurse-patient ratio, health care system, and then patients. And in this very research work, I started with the introduction. And in the introduction, I started up with the present situation of nursing shortage. Can you hear me? Hello? I started with the present situation. Okay, I started with the present situation of nursing shortage. And in the present situation of nursing shortage, I also talked about the limitations encountered during the study, usefulness of the study, the statement of the problem and causes of nursing shortage, the effect of nursing shortage on the healthcare system. Sorry, it's just unfortunate that I didn't put everything. I thought the whole presentation, the whole article would be as in line with all this. I didn't know it have to be under this. So, but briefly, the present situation of nursing shortage, the healthcare system have been on the forefront of the news and on the mind of many people. Therefore, the fact that we have a nursing the present situation of the nursing shortage, I said it's unfortunate. I thought the whole article will be placed on like this. I didn't know it's going to just be this. So, but the present situation, the nursing shortage, as in the healthcare system, is presently facing a serious problem in nursing shortage. And presently, despite the fact that the nursing is a meaningful work, the country is facing a nursing shortage that grows more pressing with each passing day. Given their importance in healthcare delivery, hospitals and other health services must address the reasons behind this growing shortage of nurses. Then the limitations that were encountered during this very study was the fact that the study was just restricted to only hospitals in Enugu State. We have so many hospitals that are experiencing the same problem. Then the usefulness of this study is useful as it helps us in getting to know the opinions of different nurses about the causes and the effects that this nursing shortage have on the healthcare system. Then the effect of the causes of nursing shortage was also discussed, was also studied in because of this project, and we got to find out that there were so many causes of nursing shortage that we found out. One of it was professional alternatives. So many people were seeking the fact that so many people seek for other alternatives in profession based on the issues that we were experiencing in nursing presently. So many nurses are becoming frustrated with their profession. They feel that they are not really making any impact, or they are not being appreciated by their supervisors, and because of this, they tend to seek for professional help elsewhere. Then we also have other causes like declining enrollments of student nurses and then educators. There are so many of the educators. We find out that presently now, most of the school of nurses, their educators are approaching their retirement age. And because of that, we know that in years to come now, we'll begin to have those situations whereby there will be no educators, to adequately tutor those students that are enrolling presently into school of nursing. Then we also have age. Age is another serious factor that causes nursing shortage. Presently, we find out that. Okay, so I'm just explained something that I didn't put all this in the PPT. I didn't really understand it. Even despite the explanation, I didn't understand it. I just thought we were going to just do this, then the article will be presented. I think that's why I'm actually explaining even why I'm going through the PPT. Did you get me? Hello?
Please carry on.
Okay. So the causes of the nursing shortage, this very one, that's what I'm discussing about. The causes of nursing shortage, I've listed two already. That's professional alternatives, which I explained. Then the second one is this declining enrollment of student nurses into School of Nursing, and then retirement ages of nursing educators also causes this nursing shortage. Then we also have another one that's still under the causes of nursing shortage. We also have age. We find out presently that most of the nurses presently now, statistically, so many statistics have given us that approximately 1/3 of the nursing workforce is over 50 years of age, and the average age of a full-time faculty nurse is 49 years. So a study published in July 2000 shows that very soon, in the next 10 years to come, that 40% of the nurses are going to approach that 50 years. They will be 50 years and older. So because of that, it also results in this nursing shortage. Then we also have another one. There is an increase in baby boomers that's still under the nursing shortage. We find out that most of the populations now that we have presently, they are aging. Those baby boomers is just the aging populations, and because of that, we find out that this aging population, they have high need for nursing services. And the fact is that the population of those that need these services now are more than the population of the nurses, people that are that can render these services. So because of that, we can see that it is still one of the causes of nursing shortage. Then we also have poor salary scale. Most times you find out that the work that nurses offer, the services that they render, is not commensurate to the pay that they receive. At the end of the day, most of the nurses, they just feel there's no need being in that profession, and they switch over to get to other professions. Then we also have the nurse-patient ratio, of which under this nurse-patient ratio, we find out that the patients that nurses take care of are greater than, normally, statistically, the World Health Organization say 1:4. But we find out that presently now, so many people at the end of the day, they are even nursing far more than what it's supposed to be. In fact, in some hospitals, it's as bad as 1:24. So because of that, it's also one of the causes of. So those are the causes. Then the next one is the effect of this nursing shortage now on the healthcare system. And some of the effects of this nursing shortage, because we find out that since the number of nurses that are required is not up to the ones that are present. So because of that, we find out that there is this nursing shortage, and it causes a serious problem to the healthcare system. We can find out some of these effects that we find out here is that so many of the nurses are frustrated. They don't tend to carry out their nursing care well, because they feel that the workload on the nurses, that's the first one, workload on the nurses is very high. Because of that, they tend not to be satisfied with their work, because at the end of the day, you find out that most of the nurses come down with backaches. They come down with, there are so many sick offs. So many nurses turn out to have sick off frequently, and because of that, it even creates more expenses on the healthcare team, because on the healthcare system, because they have to keep on spending excess money just to make sure that they try to cover up those gaps that are in there. And then because of this also, it also causes most of the nurses, they are no longer satisfied with their work, and because of this, they just tend to go in for another profession. Then the next one, it's in this study, I used this research design here. The research design here that was used was non-experimental research, was what was used, because I used the questionnaire method. And then the setting, this research work was just carried out in 10 hospitals, in different selected hospitals in Enugu State, Nigeria. And then the target population here, I just used 60 nurses were picked out. Sampling technique here was simple random sampling technique. Instrument for data collection was questionnaire. Method of data instrument for data collection was questionnaire. The method was still questionnaire. The method of data analysis was simple percentages, and then so forth. Then the next one is the results that was gotten. Here I just carefully analyzed everything here. I'll just base my more on this. From my whole this thing, I just found out that the number of years from my table 4 shows that 50% of the population of nurses that had that working experience, just 20 to 30 years
of the nurses had 50% of nurses had only 20 to 30 years working experience, and then 16.7% of the working experience of the nurses had just 30 years and above working experience. 25% of the nurses had 10 to 20 years working experience, and then 8.3% of the nurses had 1 to 10% working experience. And then from here also, I found out that in my table 5, that 91.7% of the healthcare facilities were experiencing nursing shortage, while only 8.3% of the working of the healthcare facility were not experiencing shortage. Then also, because it's in shortage, 50% of the nurses, of the respondents, showed that the possible that poor salary scale was the cause for nursing shortage. 20% of them gave the reasons of increased baby boom population. 25% gave the reason of poor nurse-patient ratio, while 5% gave other reasons like aging populations, aging number of staff nurses, and then reduced admissions into School of Nursing. Then we also had that under the effect of nursing shortage, they also gave 35% of the respondents gave reason that increased workload on nurses was one of the effects. 20% gave reason that it results in increased medication error. 20% gave reasons that it causes reduced patient care. 25% gave reasons effects that it results in unhappy and frustrated nurses. Then I also asked another question: if the respondents, if they were satisfied with their profession, and 55% of them said they were satisfied with being nurses, while 45% said they were not satisfied. And because of this, I further asked them to know the reason for their dissatisfaction, from which
Ms. Ogechi Esther, your time is up. Your time is up.
Thank you.
You just conclude the research paper. Conclude it, please.
Okay,
Your
conclusion.
From my conclusion, I just found out that the hospitals in Enugu State were having serious issues with nursing shortage. And then I just concluded by saying that the useful tips that we need in reducing nursing shortage is just increase in salary scale. Then the healthcare system should work on rationalizing the ratio between patient nurses ratio. That's it. And then further studies should just be carried out on how to reduce this nursing shortage. Thank you.